All right, I would like to call to order the March 18th meeting of the Human Services Joint Subcommittee with a roll call, please.
Assemblywoman Benitez Thompson. Assemblywoman Carlton.
Here.
Assemblyman Frierson. Assemblywoman Monroe Moreno.
Here.
Assemblyman Roberts.
Here.
Assemblywoman Titus.
Here.
Assemblywoman Tolles.
Here.
Assemblyman Watts.
Here.
Senator Canizaro. Senator Dondero Loop.
Here.
Senator Hammond.
Here.
Senator Kekeffer.
Here.
Chair Ratty.
Here. Thank you. Go ahead and mark Speaker Frierson and Majority Leader Canizaro as excused and Assistant Majority Leader Benitez Thompson present as she arrives. Well, we've been doing this for a while, and so I will just start with the remarks. If for some reason you're new to us this particular meeting and you are wanting to know how to participate, I encourage you to Google Nevada Legislature and get on the Nevada Legislature website. When you get there, you'll see that there's a help tab on every page, and that help tab will tell you all the different ways that you can participate, including calling in for public comment at the end of this meeting. With that, we're going to go ahead and jump into our first budget and invite the folks from the Aging Disability Services Division to join us.
Good morning, Madam Chair, members of the committee. I'm Dina Schmidt, and I serve as the Administrator for Aging and Disability Services Division. With me today is Jessica Adams, our Deputy Administrator over Developmental Services, Robin Hager, our Administrative Services Officer, as well as Jennifer Frischman and Megan Wicklund from our Quality Assurance team. Today, we're here to present the Developmental Services programs. These programs provide or purchase services for people with intellectual and developmental disabilities and their families with the goal of maximizing independence and community inclusion. The services in these programs include things like service coordination, family support programs, respite services, purchase of service, clinical assessments, in-home habilitation, counseling services, dogs and day training, and supported living services. Just for a little context, I think it's important to talk about the difference. We often include intellectual and developmental disabilities in this budget. Intellectual disabilities is a disability characterized by significant limitations, both in intellectual functioning, such as reasoning, learning, and problem solving, and in adaptive behaviors, which covers a range of everyday social and practical skills. These disabilities originate generally before the age of 18. For the purposes of our regional center services, a developmental disability means autism, cerebral palsy, epilepsy, and any other neurological condition diagnosed by a qualified professional. The developmental disability must originate before the age of 22 and be likely to continue indefinitely, resulting in significant limitations in at least 3 areas of adaptive behavior. And it results in the person requiring a lifelong services, supports, and other services. And I just give those definitions for context, because over time we are starting to see in our intake unit a shift from ID population to the DD population. Our intake numbers over the past year have shown a 3% increase in developmental disabilities and a 3% decrease in intellectual disabilities. Developmental disabilities often come with more complex behaviors and higher levels of need. So with that, we'll jump into the presentation. The committee has already reviewed the beginning slides of the presentation. So in the name of time, if we could just jump to slide 7 and jump into our first budget account 3166, which is our family preservation program. This program provides financial assistance on a monthly basis to low-income families residing in Nevada who are providing care in their home for family members who have a profound and severe intellectual disability. Slide 8 are the caseload projections for this program, and slide 9 is the one decision unit for this program. On slide 9, M201 funds caseload increases of 7 families in the fiscal year of 22 and 10 families in fiscal year 23. Are there any questions on this budget account?
I believe that, I'm sorry, so that budget account, I may have, you're looking at M201.
Yep, M201 is the only decision unit in that budget account.
But under 3166.
Correct.
Sorry, I think I may not be tracking, so just give me a minute. All right. Assemblywoman Carlton, it looks like you have a question.
Thank you, Madam Chair. I'm sorry, I lost my unmute button, and I too got a little confused here at the beginning when we went straight to 3166. So I guess on this one, I guess our overarching question on a lot of these is going to be how has the pandemic affected the program, the caseload, and the ability to serve Nevada families that really need these services. So if we could address that, and then I'm sure there's some overarching questions that are going to be in every single one of these budgets, like caseload adjustments and vacancies, things along that line. But if we could get that question answered first, I think that would be helpful.
Dana Schmidt for the record. So 3166, the family preservation program, is very specific. It's a monthly financial supplement to families. So that has not been impacted by COVID in this budget account. There's no wait list for these services. Currently, all families who qualify and request this service have been able to receive that. We also don't anticipate any wait list for this service in the next biennium.
Okay, I believe that answers that. So what's the caseload look like? I'm trying to look at the chart, but I'm having a hard time digesting it this morning. So I apologize. It's Thursday and I think I'm moving a little slow. It is Thursday, right? Okay. So where are we with the caseload and what do we think is going to happen in the future, especially with all the need that is out there right now?
So Jessica Adams for the record, as of February, we have 647 families receiving this service. I think it's important to note for the Family Preservation Program that it's only those individuals who have a severe or profound intellectual disability. So that is a pretty small portion of our overall caseload.
And we have not increased this amount in a number of years. If I'm remembering correctly, I don't think this has gone up since I've been in the assembly. The last rate increase was back in 2009.
Dina Schmidt for the record, that is correct.
Okay. I just think that's good for the members of the committee to understand a lot of things have changed since 2009. So thought that was good. Thank you. Thank you, Madam Chair. So, sorry, I'm a little slow on the uptake this morning. So thanks.
Thank you, Assemblywoman. I think we're both in the same place, but I feel like we both got caught up and we're there now. And it looks like Assemblywoman Teresa Benitez-Thompson is with us. So Assemblywoman, you have a question?
I do. Thank you so much. So I guess I know it's odd because we've got this rate specifically built into statute. And so there really isn't any authority or ability or permission for the division to come to us and say, hey, we've done a needs assessment and it looks like $374 in 2021 terms is not the same as, you know, what it meant in 2029 terms. And so I'm just wondering, is that assumption right? Are you able to do a needs assessment about for these families? I imagine that these are families who are opting out of the formal work environment, voluntarily unemployed, home full time to take care of their loved ones. And so I guess I'm just wondering if we know anything more about how far these dollars go for those families.
Tina Schmidt for the record. So in statute, the division does have regulatory authority over this program, so we could set the rates through regulatory processes. We have not done that historically. We've left it at that same rate, but we do have the authority to adopt regulations to establish the rates within the program.
I appreciate that. So you have the ability, but those regs aren't on the books. Is that right? Okay, so there could potentially be some conversations about how to make this more of an adaptable number. There's always budget consequences to that, but it feels really static. And I want to make sure that we, as a legislature, and whenever 435.365 was put in place, that tying the hands and making such a static rate wasn't an unintended consequence, that we didn't leave the department without an avenue to do any analysis over this rate. And that was kind of what I was trying to figure out. So thank you for the response.
Thank you. Yeah, I'm also interested in the same line of questioning around that stagnant rate. Okay, I'm not seeing that we have any other questions on 3166, so let's go ahead and move on.
Tina Schmidt for the record. We will move to slide 10, which is budget account 3280, Sierra Regional Center. Developmental disability services are provided through 3 regional centers covering the state across the state. So we have Sierra Regional Center, Desert Regional, and Rural Regional. Each region has its own budget account, so the services that are provided within each region are the same. Moving to slide 11 is the caseload projections for budget account 3280. And slide 12 is the decision unit for budget account 3280. M201 funds caseload increases in the Sierra Regional Center budget. Moving to slide 13 are the budget reductions associated with this budget account. E680 keeps frozen 6 vacant positions, while E690 is a reduction in payments through our fiscal intermediary program. This program allows family and children under the age of 18 to purchase specialized treatment, skill building, and programming to assist with successful integration into the community. Are there any questions on this budget account?
Does anybody have any questions on the Sierra Regional Center budget? I'm not,
Yes, Madam Chair, if I may.
Please, Assemblywoman Carlton.
Thank you. And this goes back to the comment that I alluded to earlier. I think in all these budgets, there's going to be conversations about caseload adjustments, and then so I think just talking about them all, I believe in general, will be good. The caseloads adjustments and the changes in the service utilization and the service request, and then provider capacity. Could you address that when it comes to the Sierra Regional Center, please?
Tina Schmidt for the record. So I will start, and then I will defer to Jessica Adams to help kind of fill in if I miss anything. So during COVID-19, many of our services, as across all of our programs within ADSB, were temporarily put on hold. So jobs and day training programs were probably the #1 impacted. We closed many of our jobs and day training centers for months. However, our supported living arrangement services continued because those folks, because they weren't going somewhere during the day, had an increased need for services and supports during the day. So we've seen a little bit of a shift. The most recent caseload projections that have been done look like we are continuing to grow. We don't have major concerns with that. And I'll turn it to Jessica just to talk about provider capacity and what we've seen over the past year.
Good morning, Jessica Adams for the record. Honestly, our providers have been amazing at making whatever shifts and whatever changes that they need to make. As Ms. Schmidt said, we did have to close our congregate JDT sites for many months during the height of coronavirus. We were able to open those back up again sometime during the summer. And in the meantime, all of our supported living providers really stepped up, brought in a whole lot of staff, worked with a lot of those JDT agencies to bring in their staff so that people weren't losing jobs, that sort of thing. So really doing a lot of really good work. I think overall, where we have seen some decreases as far as COVID with our service system, we are seeing in this current fiscal year, we are seeing quite a bit of a decrease in the average number of cases opened every single month. People haven't necessarily been coming in and applying for services at the same levels that they've done in the past. Along with that, we've also seen an increase in the number of closed cases averaged out per month. Some of those have to do with maybe families that don't want people in their homes and have just asked for us to close their case for the time being. And I think that probably as opposed to our bigger programs, the SLA program and the JDT program, some of our family support services programs have also seen some decrease in utilization, such as respite. We have a lot of families who are either not using respite at this point in time because maybe the places that they were using it has closed, or once again, they don't want people coming into their family home. So hoping all of those things come back.
And Tina Schmidt, and if I could just add to that, also, I think it's important for us to note too that during the pandemic, our Medicaid partners worked really closely with us to do an Appendix K waiver, which did allow a lot of flexibilities in our services. So we were able to continue a lot of services in manners that we didn't used to be able to do, such as jobs and day training in the home environment. So that kind of helped our providers. It also gave us the ability to make supplemental payments to our providers during the pandemic. So all of those things really helped support the network so that we didn't see a huge loss in the provider network, because we all know that these are critical services, and without that income flowing, a lot of them would be it would be difficult for them to continue business. So those flexibilities and the partnership with Medicaid and the Centers for Medicare and Medicaid Services was really critical in maintaining this structure through the pandemic.
Thank you. So it looks like we have questions from Senator Kekeffer and Assemblywoman Benitez Thompson. I think I just want to acknowledge that a lot of the answers that you may be giving may apply to not just this regional center, but also to Desert Regional Center and to the rural regional centers. So when you're giving your answers, if you would just sort of indicate if the answer sort of regional or universally applies to all the regional centers, I think that will help facilitate us moving through all of the budgets as we go. And for the members, if your question is specific to the Sierra Regional Center or all of the regional centers, feel free to clarify that as well. We may be a little erratic, but we're gonna make it through this. I think that'll make for a clearer record. So Senator Kekeffer.
Madam Chair, thank you, Ms. Schmidt. It's good to see you. I think you answered some of my questions about sort of the ability to retain some of our community providers and what's happened to them during the pandemic. But we've done some rate increases in recent years, particularly I think for JDT and maybe some SLAs as well. Can you talk a little bit about where we are in terms of our reimbursements to our community partners and whether it's at a space right now that allows them to sort of function robustly, or are they struggling based on some of the reimbursement rates?
Tina Schmidt for the record. Thank you, Senator Kekeffer. So yes, you're correct. In our jobs and day training programs across all the regions, we did a rate increase the last biennium. We are still not at the maximum allowable rate for those services. In our supported living arrangements, or do I have that backwards? Backwards, sorry, I have that backwards. So we did the rate increase in the SLA, and the jobs and day training are already maxed out. They are at the maximum rate for jobs and day training. We have been working with our partners at Medicaid to do a rate study. I think we've discussed last session too, the need for a rate study to establish not only what the appropriate rates are to maintain this network, but also really looking at the ability to create a tiered rate structure. As I mentioned earlier, we're seeing increased levels of need. And so how do we build a rate structure that allows us to support those high levels of, higher levels of need for certain individuals and not across the board, across all services. So that rate study is still being conducted as we speak. As soon as we have that, I anticipate in the future we'll be looking at what that rate structure looks like. And again, the provider network, yes, they have struggled. They've struggled to retain staff. Housing costs, especially in Northern Nevada, we know have made it very difficult for them to hire and retain support level staff. So that continues to be a challenge across developmental services.
So as a quick follow-up, do you anticipate that rate study is going to be completed during the upcoming interim, or is this a longer-term process? And I'm sure it got stalled a little bit due to COVID.
Jessica Adams for the record. So the rate study is happening right now. Providers are turning in their paperwork to the vendor now. I think it's due in the next week or two. So I believe we should be getting the results of that study probably pretty close to the end of this session. So we will definitely have them for the interim.
Thank you very much. I appreciate it.
Assemblywoman Benita Thompson.
Thank you so much, Madam Chairwoman. So I think I caught a hint to part of the answer of the question that I have, because I did see that for the 2021 work programs, that spending was higher than the 2019-2020 actual, specific like residential supports, family supports, the Title 19 community services, job and day training. So services didn't necessarily come to a halt. It sounds like you were able to shift them and continue them just in different ways. Is that what I think I heard you put on the record?
Tina Schmidt, for the record, that is correct. So with those Appendix K flexibilities, we were able to continue many of the services, just do them either virtually or in non-traditional settings. So some of those very structured rules were lifted, so it allowed us to be a little bit more flexible in our delivery of service. And then again, like I mentioned, the retainer payments to the providers that were allowable under that appendix were allowed us to provide continued payments to those that were unable to provide services.
That's great. And so that latter piece that you mentioned, those would be like the county reimbursements and the community services, and then some of the waiver stuff as well. I didn't realize that there had been that much flexibility when it came to these programs. And I mean, I think it's wonderful because it shows that that it looks like a quick pivot to change how we do things here, and that we were still able to keep supports in place and dollars going out the door. So I appreciate that.
Yeah, I would agree. I think that's a great untold story that you were able to get that flexibility and keep our providers stable and keep some level of services going. It's a win for sure. Any other questions on this budget? All right, seeing none, please proceed.
We'll move on to slide 14, which begins budget account 3279 Desert Regional. So this budget account also includes the funding for our 24-hour intermediate care facility. And I would like to take a moment to explain the impact of COVID-19 on that intermediate care facility. Much like many of the skilled nursing facilities across the state, our ICF had to close to outside visitors, and we had to keep all residents on site for several months. We faced all the challenges that all the other 24-hour facilities across the state have had, regarding the pandemic, including outbreaks of COVID within our facility, shortages of supplies needed, increased safety protocols, the creation of isolation homes, and really with no additional staff to do that. So this was a struggle this past year for our staff at the ICF. Have done an amazing job. They got very creative in ways to keep folks occupied and busy during the day and still productive. We had to increase our staffing during the daytime hours, normally where our residents would be going out off-site to a jobs or day training site. Many of them were all staying home all day. And so we had to increase the staffing levels during the day. So this really created a huge accrual of excessive overtime. I think we paid over $1.6 million in overtime in fiscal year 20. And in fiscal year 21, we're already at $1.2 million in overtime costs. So though you don't see any decision units in this budget account related to that ICF, I just thought it was important to mention the struggles and a shout out to our staff for all that they've done and all they've been through in the last year. It's been a challenge, like I say. And if you remember last session, we got 21 new positions for that facility based on the CMS findings and our system improvement agreement and the recommendations from a vendor group. But I would say that based on the overtime we've had to utilize, that there is still a burden on our personnel, and we do have concerns with burnout at that facility. So with that, I'll move on to slide 15 for our caseload projections for Desert Regional Center. And then slide 16 is the decision unit for the caseload for Desert Regional Center. Again, M201, just like we saw in the other regional center budgets, funds the caseload increase for this program. And then moving to slide 17 are the enhancements. The first enhancement is E352, which funds a specialized dental services in partnership with the University of Nevada, Las Vegas School of Medicine and their dental school. And then E380 funds a pilot program for individuals with high needs. But I would note that this decision unit was also removed with decision unit E684. Moving to slide 18 are additional enhancements. For 3279, with E805 is a request to combine 2 part-time positions into 1 full-time developmental specialist. And E900 and 500 is a transfer. I think we discussed this in the Medicaid budget of 3 audit positions from the Division of Healthcare Finance and Policy to the Aging and Disability Services Division. These will conduct audits on our SLA and JDT funding. And lastly, on slide 19 are the budget reductions for this program. E680 is holding vacant 23 positions, while E690 is a reduction to the fiscal intermediary program. Oh, and then slide 20 is the wait list. The wait list for all the regional centers. This wait list represents individuals waiting over 90 days for services. And slide 21 has the decision units to fund those waitlist services. The M510 funds the elimination of waitlist services in both Desert Regional and Sierra Regional Center budgets. The Rural Regional Center budget has no projected waitlist at this time. Are there any questions related to this budget?
Thank you for the presentation. Let's start with Assemblyman Watts.
Thank you, Madam Chair. I have 2 questions, if that's all right. The first one is really a clarifying question. So you noted in your slides that there was the pilot program in decision unit E380, but the E684 eliminates it. So can you just confirm that? And essentially, both of those decision units they cancel each other out. So they're not part of the budget recommendation. Is that correct?
Tina Schmidt, for the record, that is correct. This was an oversight, and that should not be, should have been in there.
Okay, thank you. I appreciate that clarification. And then I just had another question about the dental program at the intermediate facility. So you talked about some of the things that have gone on there, especially over the last year or so. I was just wondering if you could speak a little bit more to the dental care program in particular and how that has assisted the clients in the facility and improve their quality of life.
Tina Schmidt, for the record. So we have been working with the University of Nevada Dental School. They have a specialized dental clinic where they serve people with intellectual and developmental disabilities. It's a very sensory specific room, and so they have the special services that our population needs. And we find that many of our people that we serve struggle to get dental services. So we are hopeful that this partnership will kind of give us access to specialized services for those people that we serve who have been unable to access dental services in the community. We will continue to offer, they will always have the option of accessing services in the community, but this partnership is really we are hoping that it will increase provider capacity and increase the skill set of providers and dental providers to understand our populations better and how to better serve them. We did start this pilot and worked with them early in last year. However, with COVID, they had to, obviously, we were all impacted and dental school was not providing services. So we are hopeful that as we move out of the pandemic, that we are able to kind of increase these services. And really, it's a win-win situation for the school, gets the experience with our person served, and we get the benefit of specialized services.
Great, thank you for that. Thank you, Madam Chair, for the questions.
Assemblywoman Monroe Moreno.
Thank you, Madam Chair. I have a few questions about the wait list. With the governor's recommendation to reduce the wait list for the supported living arrangements and jobs and the day training programs, do you anticipate serving all the projected clients waiting more than the 90 days for the waiver services in the upcoming biennium? And also, in lieu of maintaining a wait list for the Medicaid waiver slots, could the agency take any action to transition the eligible individuals to the Medicaid waiver slots?
Tina Schmidt, for the record. So I'll start the answer and then also have Jessica help fill in for me. So we do anticipate, we would hope that we could serve everybody on the wait list with that decision unit. One of the challenges that we have, as we mentioned earlier, is as we see an increase in complex behaviors, we also have a challenge to get providers to serve those individuals at our current rate. So provider capacity does impact our ability to serve those folks, regardless of the funding. It becomes a challenge for us. And then I'll turn it over to Jessica to talk about the waiver slots.
Jessica Adams, for the record. So I think with the intellectual disability waiver, it is a little bit different than the waivers that we have for the frail elderly and the physically disabled, and that the regional centers do have service dollars to be able to serve people in residential programs, jobs and day training programs without needing a waiver slot. So there are many people who are already getting those services who are not on the waiver. Some may not qualify for the waiver. Some may have such low levels of service that it doesn't really make sense to put them onto the waiver. So again, I think our waiver is a little bit different in that people are getting services if they, to some extent, even if they're not getting a waiver slot.
So just a quick question. So the wait list, how long is the wait list for those that are on it for the Medicaid waiver slots? Is it 90 days as well, or is it a little shorter? Is there anything we can do to shorten that time frame as we move forward?
Jessica Adams, for the record. So everyone that goes on to the waiver wait list is prioritized 1 through 3. The highest level of priority are for those who are in some sort of institutional setting. And so for those individuals, they get onto the waiver very quickly, usually within a month or two. For those that are at the lower level of priority, I would have to get back with you as to what the average wait time is. But it is typically not a very long wait time for us.
Thank you. Thank you, Madam Chair.
I have an additional question. And I'm looking at some of the staffing and positions. Are you going to go over new positions in another part of your presentation, or is this the right time?
Tina Schmidt, this would be the right time.
Okay, great. Can you talk about how the agency has been managing your human resource needs currently and what prompted the recommendation for the human resource positions at the Desert Regional Center?
Tina Schmidt for the record. So as you know, we operate a 24-hour facility, and so we are very similar to the Southern Nevada Adult Mental Health Program. We really looked at their structure and how to support the operations of a 24-hour facility as well as community programs. And so those are in alignment with what we see in the public and behavioral health budgets to support those staff. So a lot of times what happens is we will get caseworkers, but no fiscal staff to support the increased caseload processing of those bills, the billing things, and all the operations that come with increased caseload over time. And so that is in alignment with other operations within the department.
And then could you talk about the anticipated impact of, particularly on clients, of course, of holding the 33 positions vacant?
Tina Schmidt for the record. So yes, holding vacant positions does increase the caseload ratios for our staff. And as we know, with increased caseload ratios is a reduction in quality of service. So we do anticipate there would be some impact to the quality of services and the amount of time that our folks are actually spending with the people we serve and ensuring that services are happening. So those types of things will be impacted.
Okay. The Senator, Dondero Loop, do you have a question?
Maybe. I'm also on the Thursday track of trying to wrap my brain around all of this. What, will you go to the next person and come back to me?
Sure. Let's just see, is there anybody else who has any specific questions to the Desert Regional Center?
I think that Assemblywoman Benitez Thompson may have a question.
Yep, I see it now. Thank you. Too many chats, folks. We're making our way through here. Assemblywoman Benitez Thompson.
Thank you so much. You know me, I've always got questions, probably obnoxiously so. These were kind of the same questions that I had asked before on the SRC, but I see just a couple of different things that were happening in the DRC budgets, and I just didn't want to make any assumptions about anything. So once again, see the increased spending for under the Title 19, the waiver, and the community services. I think under the waiver one, what I noticed that was different was that the spending for the DRC was twice as much of an increase as what we saw for the SRC. And so it looks like there was probably more work to accommodate changes there in this past year that I guess we might not have seen on the same scale in Washoe. Is that right?
Tina Schmidt for the record. So to your question about the increased spending, and yes, that is, you'll see those that apply across all, the answer is yes, that does apply to all budgets. So, but you've seen that. Desert Regional obviously is a much larger regional center than the other two. So that, I think that would be the the reason you would see the majority of our folks that we serve are served by Desert Regional Center.
Thank you so much. And my apology, it was in Title 19, the ICF, the ID one, where I saw a twice amount of increase in spending in 2021 versus 2020. And so I was just wondering why that was. I had said waiver, but that was incorrect because it was IFCID. And then here also as well, more of a substantial increase in those SLAs. But I guess if there was anything that was substantially different in the dynamic of what was happening with our Southern Nevada population versus our Northern Nevada population, you could just let me know. I don't know, maybe different places used respite differently, or maybe there were different dynamics that caused some of this to look a little bit different, but it's just more general curiosity than anything else.
Tina Schmidt for the record, so I'm going to try to answer your question. And to me, I think what you're looking at, like, let's talk about the Title 20 funding, the increase in this biennium over last year. So the Title 20, we gave up the funding for Title 20 in the last fiscal year due to work with our partners during the budget cuts. We worked with our partners over at the director's office grant management unit. And so that's where you see in fiscal year 20 a decrease in Title 20. That funding has been reestablished going forward. But due to offset other budget issues and items we've all been faced during the special session, we were able to give those dollars up. But you do see the increase coming back on. So it's not really an increase in service dollars, it's just a replacement of dollars that were previously in our budget.
Thank you, that helps, I appreciate that.
Sure.
Senator Dondero Loop.
Thank you. I'm back on track. I appreciate that. Thank you. So what impacts does the agency anticipate on clients from the recommended reduction in the amount of monthly financial assistance provided through the fiscal intermediary program?
Tina Schmidt for the record. So really the families that receive those they'll have less service available. So they use those funds to purchase services, specialized services. So it will reduce the amount of specialized services that each family will be able to access.
So just as a follow-up to that, do they have the means or the support to find those services that they're not going to get?
Trust Adams for the record. Our service coordinators will work with them as much as possible to be able to find other community resources. The families that do qualify for this program do have to be at 300% of poverty or less. So we would be trying to find other resources that are not costing money to be able to have them supplement what they are losing.
Thank you very much.
Okay. I'd like to just go back. I think Assemblywoman Monroe-Moreno covered this, but I'd like to just go back to it a little bit on the waiting lists. And particularly the Medicaid waiver slots. Is there a way, do we need to maintain the waiting list, or given where we are with the Medicaid budget, can we get them in faster?
Tina Schmidt for the record. So I think there are folks waiting for waiver slots. And again, I would say oftentimes we do have some service dollars to support them at some of their lower level needs while we're trying to find a provider that can support their higher level needs. So oftentimes, for example, many people will get case management services or certain services that they need to kind of help them as we work to get them on the waiver and try to find an appropriate provider. Oftentimes the people that are waiting for Medicaid waiver slots have a higher level of need, and we've been challenged with finding an appropriate provider to take on that person.
Okay, so it's less about the funding source and more about the amount of time it takes to get them connected to a shortage of providers.
Correct.
Okay, thank you for that clarification for me. Okay. Any other questions? We still have the Rural Regional Center budget, I believe. Are there any other questions generally about globally or the Sierra or Desert Regional Centers? All right, why don't we go on to the Rural Regional Center?
Tina Schmidt for the record. Moving to slide 22 is the Rural Regional Center. And in this budget account, we'll be looking at much of the same that we've talked about in the previous two budget accounts. Slide 22 is the program description, while slide 23 is caseload projections for this particular budget account. And then moving to slide 24 is the decision unit, M201, which again funds caseload increases for this budget account. And slide 25 are the budget reductions that look much like they do in the others. E680 is holding vacant 4 positions. And E690 is that same reduction in the fiscal intermediary program that you saw in the other budget accounts. Are there any questions related to this budget account?
I'm not seeing anybody. Does anyone have any questions specific to the Rural Regional Center? Okay. All right. Anything else, Ms. Schmidt?
Dina Schmidt for the record. No, that concludes our presentation. We're happy to answer any other questions generally about the developmental services if there are any. But that is the conclusion of our presentation.
I appreciate that. I think we bounced around a little bit, but I think we got there. I think to summarize, I just want to again express my gratitude to you and frankly the whole team that you represent that I'm sure was working with a lot of stressed out individuals to help them navigate a pandemic with some. Sounds like you got some great flexibility in some of your funding sources to be able to be nimble and to react. So I wanted to just thank everybody for that. I also wanted to acknowledge what you said about the positions at the Desert Regional Center and the overtime and how some of your folks are under stress and that those two things are happening simultaneously. So just wanted to acknowledge that and express that in the midst of all that, that was heard. Sounds like we have some impacts based on keeping some vacancies open, a rate increase in the family preservation program that hasn't gone up in a while, the cut to the fiduciary program. And so we appreciate you taking the time to walk us through it. And I apologize if in my leading the discussion, we jumped around a little bit, but I think we got the information we needed. But thank you. Thank you to you and your team again. With that, I'm going to go ahead. I'm looking around. I don't see any lingering questions. I'm going to go ahead and ask DPS. We're going to move to public comment. So if you would go ahead and open up the lines for public comment.
Thank you, Madam Chair. We are currently on public comment. If you have recently joined the call and would like to provide public comment, please press *9 now to take your place in the queue. Caller with the last 3 digits of 711. Please slowly state and spell your name for the record. You will have 2 minutes and may begin.
Good morning. My name is Chris Vito, V as in Victor, I, T as in Tom, O. I'm the president and CEO of Nevada Adult Day Healthcare Centers. Good morning. I'm extremely grateful for this, for being the state's partner to care for our state seniors and individuals with intellectual, developmental, and even physical disabilities. I appreciate you allowing me to speak today. Nevada Adult Day Healthcare Centers is an alternative level of care for individuals who want to continue to live at home with their families rather than being institutionalized. We are a medical model, so we have nurses, physical therapists, we can even have physicians, dentists, podiatrists, mental health services, imaging services. As a matter of fact, we partnered with a lab to offer COVID testing in October and even vaccine clinics in all our facilities for our clients and staff. As the state's jobs and day training provider for the Desert Regional Center and Joan Caber's team. We are very fortunate to be selected to care for our intellectual, physical, and developmental disabled citizens. Very similar to Medicaid's mission, Nevada Adult Day Healthcare Center's mission is to strive to maintain their independence for as long as they are able and preserve their dignity. This pandemic has taught us to be more creative so we can be more effective for our clients' well-being. We have done this through technology, in person, and even virtually. We believe we will have even better clinical outcomes in the next few months. Despite these lessons of trying to be efficient and effective for our clients, the state's decrease in reimbursement or static reimbursement has been discouraging. In addition, the looming crisis of a minimum wage increase will obliterate small businesses like mine unless the state's reimbursement schedule is dramatically adjusted. Fortunately, Dina Schmidt, Jessica Adams, Jennifer Frischman, and her management team, and Joan Caber and his team at Desert Regional Centers have been in constant communication with their providers and have reminded us that we are essential for the health and safety of Nevada's individuals with intellectual, physical, and developmental disabilities. This encouragement and support from them have been keeping us very hopeful. Thank you very much. My name is Chris Vito with Nevada Adult Day Healthcare Centers.
Thank you, Mr. Vito.
Caller with the last three digits of 692. Please slowly state and spell your name for the record. You will have 2 minutes and may begin.
Thank you. Thank you, Madam Chair and members of the committee. For the record, my name is Mary Przinski, MaryPierczynski, working with Foster Consulting to represent SNAP. SNAP stands for the State of Nevada Association of Providers. It was created in 2006 to have a combined and stronger voice on policy issues and Medicaid reimbursement rates that affect those we serve. SNAP serves those with intellectual disabilities to meet their housing, transportation, social, and employment-related needs. And SNAP greatly
EPS, it seems like we've lost Ms. Brzezinski. Is that something we can correct?
Oh, I don't know how much you heard of what I said, but if I may continue.
Please go ahead.
SNAP serves those with, oh, thank you. Thank you. I appreciate that. SNAP serves those with intellectual disabilities to meet their housing, transportation, social, and employment-related needs. And SNAP really appreciates the professionalism and the dedication of Dina Schmidt and her team at ADSD and the regional centers. SNAP membership is statewide, working with all three regional centers. We represent the vast majority of providers in the state. We appreciate your assistance in helping providers meet the needs of those they serve by providing occasional adjustments in rates. You will be hearing about the concerns providers have with the minimum wage increase. They are completely supportive of the increase, but they need the legislature to remember that most are 100% reliant on Medicaid dollars to support their operations and pay their employees, and they're unable to raise outside dollars. Thank you for allowing SNAP providers to partner with the state to serve our most vulnerable population. And thank you very much for your time this morning.
Thank you.
Caller with the last three digits of 688. Please slowly state and spell your name for the record. You will have 2 minutes and may begin.
Yes, my name is Troy Frieden, Troyfriden. Thank you for taking the time to listen to my public comment this morning. I'm the Chief Operations Officer for Chrysalis. Chrysalis partners with all three ADSD regional centers, Desert Regional Center, Sierra Regional Center, and Rural Regional Center. We provide services for over 220 people with intellectual and developmental disabilities in Nevada, and we employ nearly 600 professionals throughout the state. It's my priority to use our state Medicaid resources responsibly and to help each individual meet their full potential. One of our biggest challenges is ensuring that our Medicaid-supported reimbursement rates sustain a fair wage for the direct care staff. We're very concerned about the looming crisis that is coming to our industry. The increasing state minimum wage in Nevada will cause rates for critical disability services to fall behind our ability to pay staff at least minimum wage. It's necessary to raise these Medicaid rates to be at least commensurate with the rising state minimum wage that began to go into effect last year. Funding for these services relies exclusively on rate adjustments from this legislative body. Raising the minimum wage without also raising our rates for these services will create a crisis where disability providers will no longer be able to operate in the state of Nevada. To be clear, I'm not opposed to the increasing minimum wage in Nevada. On the contrary, I'm very supportive of the efforts to raise wages for our direct care staff. Our staff provide an essential social safety net for some of Nevada's most vulnerable citizens. Without heroic caregivers, many people with disabilities would be at risk of neglect or homelessness. Their work is noble and deserving of a fair wage. I'm grateful to the state's commitment to serving this wonderful population of citizens, and Chrysalis is extremely thankful for the legislature's willingness to provide the increases we have previously received, as those increases allowed us to raise wages for our direct caregivers across the state. Thank you.
Thank you.
Caller with the last three digits of 928. Please slowly state and spell your name for the record. You will have 2 minutes and may begin.
Good morning, Madam Chair and members of the committee. For the record, my name is Nate Boyack, N-A-T-E B-O-Y-A-C-K. I am the current SNAP president and the executive director of BAI, a supported living provider based in Las Vegas. I appreciate your service to our state and the individuals we support. I also appreciate the time to testify in support of Dina Schmidt and ADSD's budget presented for the regional centers. Lisa Foster, SNAP's executive director and lobbyist, emailed an infographic to members of the committee, which identifies the major support concerns we have for our services. In July, minimum wage is going to increase by 75 cents and will do so at the same rate for the next 4 years. Within 16 months, we will be unable to pay our caregivers the salaries required to attract and retain them for the jobs they perform. These employees' responsibilities far exceed duties consistent with a minimum wage occupation. At our current funding levels, minimum wage increases outpace Nevada's funding for services. Without a corresponding rate increase, we as providers will not be able to pay our employees enough to provide the supports that are necessary. Currently, the federal government pays approximately 66% of the cost of our services. With the most recent COVID relief package, that funding has increased by an additional 10% for the next year. We ask that as these additional federal funds have been allocated for our services, the legislature act to increase service rates in order to keep pace with Nevada's minimum wage increases. Thank you again for your time and for your service.
As a reminder, we are currently on public comment. If you have recently joined the call and would like to provide public comment, please press *9 now to take your place in the queue. For those that just joined the call, if you have recently joined and would like to provide public comment, please press *9 now to take your place in the queue. Caller with the last three digits of 823. Please slowly state and spell your name for the record. You will have 2 minutes and may begin.
Hi, my name is Justin Beldo. That's Justinbeldo. One of my biggest concerns, and I do work for Aging and Disability and Equality Insurance Department, is that with the raising cost of housing, that are we able to maintain, and much like Mr. Vito mentioned, are we able to maintain an income level that the providers can afford and that our frontline direct support staff can live off of? One of the things I do worry about is that we have a lot of turnover going on, and the biggest thing that can impact quality of care is having the right people in the right roles who are also stable in their jobs. That stability is key. So that is the extent of my public comment. Thank you.
As a reminder, we are currently on public comment. If you have recently joined the call and would like to provide public comment, please press star 9 now to take your place in the queue. Chair, the public line is open and working, and there are no additional public callers at this time.
Okay, well, thank you to all the callers who took the time to participate with us this morning. We appreciate it. With that, thank you to all of the staff and members, and everybody have a great rest of your day. We are adjourned.
Thank you, Madam Chair.